Hello. Hi, everyone. First of all, just thank you to the organizers for having me. I'm Marcos. I'm finishing my PhD at UC Davis, and I will present this ongoing work titled Community Matters, Psychological Well-Being and Spillovers in an Asset Building Anti-Poverty Program in Paraguay. So I'm going to be presenting work on the graduation approach, which you might have heard of in other sessions or in your own work, which consists essentially of a bundle of an asset transfer and a mentoring component for low-income households to start a new business or to expand their current business, right? So this could look like a transfer for people to buy small animals like pigs or products to stock up their stores. I'm going to use a motivating example of the promotional material of the program. So let's say Ellie is a housewife who is a good cook and who sometimes takes orders to make lunch for people in the neighborhood. So she could use the program money to, for instance, set up a dining space in her house or to hire a delivery person in order to be able to fulfill more orders in the area. However, even though these are, of course, good things for Ellie, having this expanded business is going to bring in some challenges, maybe in handling finances she's not used to handling, maybe in managing people in a way she's not used to doing, right? This could bring along some stress, some complications for her, right? The key idea behind this example is that to succeed, micro-entrepreneurs need, yes, physical assets, but not only that, they also need business knowledge and some intangible psychological assets. So these graduation programs are multifaceted interventions designed to help households escape poverty. If we think about how these assets differ, we know that physical assets can be raised directly through a transfer. However, a program can attempt to raise knowledge and psychological assets through training and mentoring, but there's actually no guarantee that the intervention will achieve this goal, right? If effective, building up both tangible and intangible assets will facilitate this livelihood transformation. We have to think about how, for many households, this new or expanded business represents uncharted territory. And these programs also often target women who may face resistance when adopting a new role within their communities. Overall, the literature shows that this program is effective in helping families indeed begin their path out of poverty. What my study focuses on is, first of all, in the fact that the direct effects of these kind of programs on psychological well-being is underexplored. We have hinted at how beneficiaries might not be well positioned to navigate the major changes this program entails. So using a randomized controlled trial that measures various psychological outcomes, I ask what the impact is of the program on psychological well-being. Beyond that, I think about what can help participants avoid the stress as they navigate this livelihood transition, right? One thing is the mentoring component of the program, which is actually designed a little bit to do this, right? And previous studies highlight how this component is essential for the effectiveness of the program, and versions of the program that don't have this component lead to muted or smaller effects, right? However, I focus more on the neighborhood and community dynamics and how through various mechanisms such as role models, peer effects, social learning, this can help participants avoid the stress. So by randomizing the level of exposure to neighbors who participate in the program, I ask whether social dynamics can help participants maintain or improve their psychological well-being. In other words, whether community matters. So to have a preview results here, using an RCT with a staggered rollout and a design that randomizes exposure to spillovers, evaluate the graduation program Tenondera in Paraguay. So at midline, 10 months into the program, I find that for classic economic variables, average treatment effects are positive. The program raises income, assets, and savings 10 months into the program. As far as psychological well-being, though, these measures all decline by the stage of the program. So we see a deterioration in psychological state here. The saturation analysis reveals that in communities where there's a higher share of beneficiary households, treated households actually achieve better economic outcomes, and the decline in their psychological state is less severe. And finally, I comment a little bit on how these psychosocial factors can explain some of the heterogeneity that I find in impacts of the program, where some households see no benefits in income and some households see no benefits in assets. Okay, so the program I study is this government-led graduation program called Tenondera in Paraguay. It lasts for 2 years, and the main component is this seed capital transfer, one time of about $400, which is a sizable amount. The program launches with a series of group workshops that cover financial entrepreneurial skills and also life skills. In my context, both rural and urban households are covered, and women are in most cases the main beneficiary on paper, but in practice, businesses are often run jointly between the woman and their partner. The assets are chosen by households based on their business plan. These could be animals, products to stock up stores, materials to support the offering of services like laundry or manicure, and then mentoring lasts for the remainder of the program. My sample contains almost 3,000 households in about 250 communities in 3 departments in Paraguay. The households were randomly placed on one of 3 treatment groups in a staggered rollout setup. I have 3 survey rounds covering economic and psychological variables. However, today I'm going to present data from the midline, which is comparing early treated households 10 months into the program against a pool of late treated and control households. It's important to note here that treatment assignment is at the individual level, but saturation is a community measure, right? So saturation here is a measure of the share of households that participate in Tenondera in a given community, again meant to capture exposure to neighbors who receive the program. So by design, different communities will have different levels of program coverage by midline. To estimate this first set of results, I use a standard IDT ANCOVA model, where I regress the outcome variable of interest on the treatment assignment indicator and the baseline value. And I add on district fixed effects. So like I mentioned, for the key economic outcomes, there's an improvement across the board. If we think about the magnitudes a little bit here, they are smaller than the usual effects reported by the end line of similar programs. If we look at the assets increase, that's smaller than the transfer size of about $400, so there's an erosion there going on. This could be partly that some assets are already transformed into income increases, right? And besides that, there's actually a few households that save in this context. Before I move on to the psychological results, let me just describe briefly the measures that I use. So I cover depression, which captures emotion and emotions in general well-being experienced by the respondent. Aspirations, which deals with a person's satisfaction with their current scenario and their plans for improvement. Self-efficacy, which deals with a person's perception of their capabilities and their ability to reach their goals. And locus of control, which measures the factors to which a person attributes control over things in their life. In particular, internality measures how confident a person is in their own abilities to control their life. So like I said, the pattern here is quite staggering. I find a decline across all these measures, right? The second panel is the most easy to interpret here, where the share of people who are depressed among the treated households actually increases in treated communities. Same with share of people who have low aspirations, low self-efficacy, low internality, and overall poor mental health. So this is a reflection possibly of how program expectations for participants to transform their livelihoods could induce some distress. And also that as currently designed and implemented, the mentoring component of the program, in my context, might not be completely successful. Moving on to how spillovers interact with these results. I use the saturation design, which by midline, different communities will have different program coverage rates by design, right? So in some communities, no one will be treated by midline. In other communities, only 20% of households. In other communities, only 67% or 80% or all households, right? These were the target rates that varied slightly with implementation, resulting in a more continuous measure. So based on that, I classify communities based on their saturation rate by midline into a 0, a low, a medium, and a high saturation group. And I run a modified version of my initial specification where I include these indicator variables for the different saturation groups. And what I am able to estimate is the direct effect on the different groups and then the spillovers as well. Okay. These results are a bit harder to go through in a short time frame, but here, kind of like the key takeaway comes from the rows that are interaction of medium saturation and treated and high saturation and treated, where there's a consistent pattern of negative point estimates, meaning that the share of people who are depressed or have low values of these other psychological measures is actually lower in these higher saturation communities compared to communities of other saturation levels, right? So in psychological measures, treated households perform better when program coverage rates is higher in their communities. This story is coherent when we look at economic outcomes. For instance, we see that for income, households who are treated in high saturation communities are the ones who perform the best. And something similar happens for acids as well, right? Okay, so summarizing this subsection, the saturation analysis suggests that the decline in psychological well-being is attenuated in communities with higher program coverage rates, and the beneficiaries in these communities actually experience better economic outcomes as well. We know that there's a number of mechanisms by which an asset building program like this could generate spillovers. The spillovers could be psychosocial, especially considering that these psychological assets are non-rival goods that can be shared. So this could manifest as networks of support and learning among beneficiaries. Spillovers may also be pecuniary, where increases in the number of beneficiaries bring along these market forces of congestion, competition, or agglomeration. Right? So bringing in my end-line data later on, I will examine how program affects local industry composition. But an important message here is that just the results are not fully consistent with some of these market forces. So I think that psychological measures and psychological spillovers should not be ignored, should be considered seriously. Okay. And another just motivating fact here, I here document how the program brings along heterogeneous impacts for the distribution of participants, where, for instance, for business assets, by midline, some households are left with no change in assets, while others actually accumulate assets beyond the transfer size, right? So the reasons behind this heterogeneity is not well understood in literature. So I hope that my study, by looking at psychological well-being and community dynamics, is going to contribute to illuminate some of this heterogeneity. Okay, so just to give a couple actionable findings based on what I discussed. One thing is about community implementation. So an actionable finding perhaps is that it's more important to, in communities, be more universal about who receives the program in terms of the eligible people rather than more selective, since it seems that this higher saturation rates actually benefit treated people. And another actionable finding is just thinking more about the way these economic and psychological outcomes might be reinforcing each other. So considering explicit components of psychological support has proven valuable in other contexts. So this could also just help ameliorate this psychological decline, but also have even more positive impacts in economic outcomes. And I will stop there. Thank you.